WXXI's live forum is made possible with support from Excellus Blue Cross Blue Shield, with a mission to help people live healthier and more secure lives through access to health care. And by the Greater Rochester Health Foundation, working to pursue and invest in solutions that build a healthier region where all people can thrive.
Good evening, everyone. I'm Norma Holland. Thank you for joining us for WXXI's live forum, Racial Disparities in Rochester. In the early hours of a cold March morning, police restrained a black man in the streets of Rochester. 41-year-old Daniel Prude was in town from Chicago to visit his brother. The night before, he was released from Strong Memorial Hospital after being seen for a mental health issue. The next morning, police found him running naked through city neighborhoods. He was going through another mental health crisis and was under the influence of phencyclidine, or PCP. What happened next wouldn't be known to the community until months later, when body camera footage was released to the public. In freezing weather, while Prude complied with police, an officer knelt on his back until Prude suffocated. He was taken to the hospital and died a week later. His death, which has been ruled a homicide by the medical examiner, happened 2 months before the killing of George Floyd in Minneapolis. As many Rochester residents took part in Black Lives Matter demonstrations protesting Floyd's death, they didn't know that a black man had died after being restrained by police in their own city. What followed has been weeks of protests and calls for city leaders to step down. Protesters have alleged the city government has covered up the details of Daniel Prude's death from the beginning. The question tonight is, how could we get to this point? And where do we go next? Tonight's forum is a chance to examine the systemic issues that led to Daniel Prude's death. While this case has upended the local community, Prude's story is emblematic of problems that have existed across the country for decades. We're going to discuss how poverty, racism in the criminal justice system, and racial disparities in mental health care created the backdrop for a tragedy that has brought this community into the national spotlight. Our guests will help us to understand those issues and help us to navigate what groups, individuals, and leaders can do to create change. Our panelists are joining us in studio and remotely tonight. We want to emphasize that they are physically distanced from me, our crew, and each other. And we'd like to assure everyone in the audience that our team here is working to take every precaution, wearing masks and making sure that our panelists and each other are safe. I'd like to welcome our guests tonight. And as I do, we're asking each of them to describe themselves for members of the audience who are blind or visually impaired. So I'll start. I'm a light-skinned Puerto Rican woman in her 40s wearing a green suit. So, joining me in studio, Simeon Bannister. He's Vice President of Community Programs at the Rochester Area Community Foundation and member of the Greater Rochester Black Agenda Group. Simeon, thanks for being with us tonight. Great to see you again, and please describe yourself.
Great to be with you, Norma, and thanks to my friends at WXXI. Thanks to friends at the Greater Rochester Health Foundation. I am a black man. I am in my late 30s, close cropped, and for the first time in 6 months, I am wearing a suit and tie.
And you wear it well.
You
wear it well, Simeon. Great to have you with us tonight. We appreciate it. Natalie Ann Knott is Assistant Public Defender with the Monroe County Public Defender's Office. Natalie Ann, thank you so much for being with us tonight. Please describe yourself for the audience.
Thank you for inviting me here tonight, Norma. I am a Black Latinx woman. I have short, dark, curly hair. I wear glasses, and I am wearing a gray blazer and a dark green blouse tonight.
All right. Thank you so very much. Joining us remotely this evening is Dr. Janice Harbin, dentist and president and CEO of Anthony L. Jordan Health Center. Dr. Harbin, we appreciate you being with us tonight. Can you please describe yourself?
Thank you, Norma. I am an African-American woman, 66 years old. I wear my hair natural in very tiny braids called sister locks. I am wearing a hot pink jacket with a matching blouse this evening.
All right. Thank you so much, Doctor. We appreciate it. Also joining us remotely, Professor Marvin Stefferson, retired Rochester Police Department Sergeant and Adjunct Professor of Criminal Justice Administration at Roberts Wesleyan College. Professor Stefferson, please describe yourself.
Good evening, Norma. I am a male black, bald, with a peppered black and gray goatee, a button-down light blue shirt with collar, and I am 54 years of age.
All right. Thank you so very much. We appreciate it. Also joining us tonight, Dr. April Aycock, licensed mental health counselor and master's level credentialed alcoholism and substance abuse counselor. Dr. Aycock, please describe yourself.
Hey, Norma, thank you so much for having me, and thank you to WXXI. I am a Black woman. I have short hair. I'm wearing a black blazer with a black and gold necklace and red dress, and I, for the first time, have been able to put on red lipstick, and I'm loving it.
I would say we're joining you. I'm joining you tonight in that same thing. So we appreciate you being with us, Doctor. Wonderful to have you. We also want to let our audience know tonight that Dr. Aycock chooses not to share her opinions on Mr. Prude's case out of respect for him, his family, and the ongoing investigations. She is joining the discussion to talk about broader systemic issues surrounding mental health addiction and treatment. Also, the views and opinions that she expresses do not reflect the views or opinions of her professional affiliates. And we did invite Mayor Lovely Warren to take part in tonight's discussion, but her office did not respond to multiple requests. We have also invited representatives from the Rochester Police Department, but they were unable to join us this evening. And just a reminder that you can submit your questions for the panelists this hour by emailing forum@wxxi.org or by tagging @WXXI News on Facebook and Twitter. We've got a lot of ground to cover in this hour-long broadcast, and if you are watching live tonight, October 1st, and you want to stay with us after 9 o'clock, we're going to continue the conversation online at WXXInews.org and on Facebook Live until 9:30. All right, let's go back to our guests right now. And I'd like to start by asking each one of you what you hope will come from tonight's discussion. Simeon, we'll start with you.
Yeah, in moments like this, so much heat is shed. Tonight, let's shed some light. Let's do some learning this evening together. Let's appreciate that there are complicated and sophisticated challenges that we're confronting as a community, and let's do them the due deference of digging in. If folks walk away having learned something tonight, that'll be a success.
That's great. Thank you, Simeon. Natalie Ann, can you join us and tell us what you think, what you hope people will get from tonight's broadcast?
Yes. I'm excited to have a substantive conversation about the very real issues and real possibilities for solution we have in this community to deal with the issues that arise and are in many ways emblematic in the Prude case. Without histrionics or obfuscations of the issues by histrionics. I'm really excited to really dig into some proposals for very workable solutions that can prevent what happened to Mr. Prude from ever happening to anyone again in our community.
All right, thank you. Dr. Harbin.
Yes, I think although it is very sad that we have to have tragedies to have honest conversations about what goes on in communities, especially communities of color, communities of stress, communities of need, but we're having that conversation. This panel is representative of the many voices that are needed to really bring a village together to not only heal, but have solutions and have progress. We keep talking about different things, but actually to have progress and movement and changes that need to take place in our community for us to have a healthier community.
All right, Professor Stefferson.
Yeah, I think, sorry, most people here have kind of stolen my thunder. The fact that we have all of us here on the panel tonight and so many that are viewing this, the conversations, I am hopeful and I'm positive in thought that this is going to be just a catapult moving forward for change, as long as all minds are open and hearts are open to what we are going to talk about tonight.
All right. Dr. Aycock.
Yes. So really to talk about mental health and substance use especially when it comes to the Black and Brown community. There's a lot of talk about how do we revamp, how do we reimagine services, but the most important thing is to make sure that we have Black people at the table and at the decision-making process. Other than that, 3 years, 5 years from now, we're going to be at the same place. So I'm hoping that we will be able to provide some awareness and some movement will continue.
All right. Thank you so very much, my panelists, for sharing your thoughts tonight. Let's start our discussion with the topic of policing. The case involving Daniel Prude has eroded the trust that the community has with police and city leadership. Professor Stefferson, given your background as a retired Rochester police sergeant, what do you think it will take to build trust in policing after this incident? And is it possible?
Well, I always look at the glass as being half full, so I know it's possible as long as we all believe that listening, not just speaking, but listening to one another, we can make positive change. Now, the first thing is that we have to acknowledge the trauma from the institution of policing in its inception in our country. If we don't acknowledge the past, then we cannot move forward in the future. And so teaching through education inside the school system, inside the police department, from the top down, and then also in the community. Once we actually acknowledge our past, start looking at some substantive changes in the current state, I believe that you will see the community embrace us, because right now you have a lot of people doubling down on their position and not acknowledging the accountability that they need to have, that they're asking the community to have of themselves.
Okay. There have been calls to defund the police, change the way police make mental health arrests and respond to crisis calls, among many other things. So what one piece of reform do you think will have the most significant impact at this stage?
Probably the most impactful thing in the short term would be a matter of not looking to defund without actually looking at what you need to implement to help the police do their job better. And then when you have a destination of where the money that you're going to take from the police department to go, I think that's when you will see positive change on the short term. So we can't talk about taking money away from the only resource that's out there working, even if it's not working properly or efficiently. To remove money without having a destination and a plan of how you're going to utilize it is a wasteful action in itself.
How about training? Do you think that training needs to be changed, or the methods in which police use to apprehend suspects?
I believe we start with some training, and that means bringing in the right folk that you want to be. I guess my thought process right now, we're struggling with mental health. We're struggling with cultural relevance. Mm-hmm. So the training shouldn't just be about, picking up a tool, whether it's a baton or the handgun or pepper spray. It should be some more social training, bringing in folk that are in social work, sociologists, and talk about how do we communicate and how do we look at the community that we're serving in a more positive light. So
right.
Those are things that I think that need to be part of the training before we just talk about actual training like we saw with the video of Daniel Prude's death.
Right. Okay. We took a look. There was just on the screen there a study about 2016 report from the Police Executive Research Forum that found that nationwide police academies spend a median of 58 hours on firearm training and 8 hours on de-escalation or crisis intervention. Let me continue. There have been questions about whether Daniel Prude would have been treated differently if he weren't suffering mental health and substance abuse issues, and more specifically, if he weren't a Black man suffering from mental health and substance abuse issues. Would he have been asked, or would he have been asked if he wanted a blanket? Would he have been placed into the ambulance instead of on the ground? Natalie Ann, what is your take on that? And does wanting law enforcement reform make a person anti-cop? Can you support police and still want them to change some of their training and actions during calls for help? Is there a middle ground here? Natalie Ann?
I think there is possibly a middle ground. I myself don't subscribe to it. I don't think it is possible for a community like Rochester to build trust with a police organization the way it is currently structured, the way it currently functions, and the way it currently sees itself. Do I think all police officers are bad people? Absolutely not. But do I think that a bad, inherently corrupted structure can make good people do things they otherwise would not do, or fail to do things they otherwise would do? Yes, absolutely. And I think that our issue that we really need to get to the bottom, to the ground on, is that it's not so much that there's bad officers, it's that the structure of policing as we understand it does not function properly or well in our societies. It does not function well. It definitely doesn't function well for Black people, and it doesn't really function that well for white people either. If we are actually going to drill into the facts of what happens in a community with their police department.
All right, so getting to that about the way that police react or have interactions with the community, a 2019 study from the Proceedings of the National Academies of Sciences found that over the course of a lifetime, Black men and boys risk being killed by police at a rate of 96 out of 100,000 deaths. By comparison, white men and boys face a lower rate of 39 per 1,000 deaths, despite being a bigger portion of the U.S. population. Now, there have been a lot of questions about who knew what about the Prude case and when they had that information. We know that our panelists cannot comment directly on the investigations into those questions, but what would you like to see city leadership doing at this stage? I want to go to Professor Stefferson to have his take on that in terms of what he would like to see city leadership doing, but also, did you have an opinion on wanting police reform, but also supporting police? Can you be both? Can you, does wanting law enforcement reform make a person anti-police officer?
Well, in my mind, no. But in reality, police don't want to be criticized. All right. And I always say to my officers, because I did firearms instruction, I did DT instruction, you have to be able to critique yourself in order to grow. And so looking at the mindset, going from the warrior mindset to the guardian mindset, we have to, like Natalie said, we have to start a restructuring from the mindset so that when we implement training, it's effective. Not every taught tactic is going to be an appropriate tactic, just like not every approach is going to be an appropriate approach for every scenario that you come involved with. That's why I took the job in the first place, because I get up every day and I go out and I do something different. I meet people that are different every day. So you got to be able to critically think on your feet. And that means that you got to have the training that is going to expose you to that type of practice. And right now, we don't have that. And I think the administration's got to look deep inside, and the union's got to be on board with them, because it's going to be support in these states where you have union representation, not via rightful work states that we have.
What about city leadership? What should they be doing right now?
They should not be pointing fingers right now, which I know is difficult when you're on the hot seat and you have people on the outside judging that really aren't familiar with what policies and practices are and what training are being performed inside the department. But they're going to have to circle the wagons, sit down at the table, take a look at what did not work, what does work, be transparent. It's painful, but they're going to have to be transparent, because that's how you're going to gain any type of support or trust that you may have lost or that you're looking to establish. And then from there, using your partners in the community. They want to be a part of change with your organization. Use their insight from a different perspective.
Okay.
And start moving forward to addressing some of the issues that failed us. How
about you, Natalie Ann? City leadership, what do they need to be doing right now?
Well, I would like to see some leadership. I think that I am sympathetic to Mayor Warren back when she first heard about this issue in early April, late March, that there was a lot going on. We were at the height of the COVID crisis. However, I don't find it excusable that she heard about a death in custody and then did not immediately demand to see the video of it, considering the climate we have been in for quite some time. I think that responsibility needs to be taken. I think it's a real disappointment that she has not addressed the public outside of closed press conferences. I think that it was a failure of her entire administration that more follow-up wasn't done immediately when their office heard about a death in custody. We cannot be the whole reason we have a chain of command in government is so that people are checking up on other people. The famous checks and balances our country was built on, allegedly, is so that branches of government are checking up on each other. And when Mayor Warren's office heard that there was a death in custody, that body cam should have immediately been reviewed by her office and immediate steps were taken. I think it's also very disappointing that at first the mayor tried to hide behind the Attorney General investigation and claimed that she was not permitted to say anything about this when she learned about it. That has since been proven wrong.
Okay.
And I think that that's a real vacuum absence of leadership
Okay.
on many fronts.
All right. Simeon, would you like to weigh in on this?
Yeah, just point out that if you want trust, then you have to be trustworthy. If you want credibility, you have to be credible. The model of leadership that I've seen in this crisis, certainly our Attorney General Tish James is, and her coming to Rochester has been open and transparent about calling immediately for the grand jury. I think that was an appropriate step. Was credible in terms of for articulation of the rights of protesters. I think that was an important step. And I think ultimately the question that we have to ask ourselves, this community is getting ready to go through a very, very difficult time. We need to acknowledge that COVID and the economic implications of COVID will potentially ravage this community if we're not prepared to make some sacrifices. And having folks make sacrifices is a function of the credibility that one has. I would encourage all folks to be thoughtful about that.
Right.
Can you lead in this moment? And if so, then do so.
All right, Simeon, we're going to pivot now to a topic that you know a lot about. Rochester remains among the poorest cities in America. It is the first in cities of its size when it comes to poverty. More attention to the problem has highlighted the role that racism has in creating and perpetuating generational poverty. So, Simeon, has this recent movement reignited the drive to find ways to end it? I realize we're pivoting from law enforcement to poverty. There's so many, we only have an hour, less than an hour now, so there's so many things we want to get to, but poverty is a huge issue here, Simeon. What do you think? What has this reignited ways or the call to find ways to end it?
Yes, it has, of course. This moment, we have to recognize that Daniel Prude's murder is a crystallization of so many issues that we see in this community, in healthcare, in education, just across the board. I'll tell you this, my father was 67 years old when he passed away, a very young 67 years old. When my dad was a kid, didn't get great health care when he had rheumatic fever, and that affected his heart. Got a little bit older, dealt with being one of the few people of color in a senior level in one of our great companies here in Rochester, and dealt with all the stress that comes from it. The same forces that we saw of structural racism that resulted in Daniel Prude's death are the same forces that leave my kids without their grandfather to play with and to have fun with. And I think that's really what we have to really wrestle with. We are the poorest city in the country of our size. We do have the highest level of childhood poverty in this country. And that is fundamentally a question of a lot of historical policy decisions that have gotten us to this point. And if we are attentive to that history, if we try to get smart about what happened, there are breadcrumbs and clues along the way that help us to figure out some of the strategies that we might use to remediate some of these problems.
Simeon, in your work, you emphasize that these gaps, that we talk about and we know are generations in the making, right? What are some of the racist policies and practices such as redlining that we've talked about so much that have brought us to this point?
Absolutely. Redlining, restrictive covenants. We know that the Homeowners Loan Corporation in the 30s created maps that identified good neighborhoods versus bad neighborhoods, and those bad neighborhoods cross-referenced with people of color. So what we ended up with is a geospatial organization of poverty. In Rochester, not only do we have poverty, but it's a concentrated poverty. It's a very virulent kind of poverty because it's retrenching and it continues to build on itself. These historic decisions, one of the things folks should know, viewers should know, is that people of color in Rochester are a relatively recent phenomenon. Before 1950, less than 2% of folks in the city of Rochester were people of color. Think about what that means. 1950 was the year that we had the census at least, that we had the highest level population in this community's history. 332,000 people lived in Rochester. 7,800 of them were people of color. As the community started to grow in the 50s and 60s and 70s, we also saw white flight to our suburban towns. And the white flight was accompanied by, frankly, a lot of the economic resources. And so what we ended up with is a city that is concentrated poverty organized by race. And if we don't deal with that very stark fact, then I can't see how we make meaningful headway.
Okay. All right, Simeon, thank you. I appreciate your views on this, and certainly the data backs that up, as we saw just a moment ago. Simeon, you alluded to the issue of healthcare, and Dr. Harbin, what role does poverty have in keeping people from accessing quality healthcare, and what can we do to improve access to healthcare? And I know you know so much about this as the head of Anthony Jordan Health Center, which is in the middle of the city of Rochester and sees so many poor and under and uninsured people.
Correct. Jordan Health, we're in 3 quadrants of the city, the so-called crescent of the city, where the majority of the poverty is concentrated. I have a town hall meeting talking to my staff every Friday, and one of the issues that I brought up was that systemic racism, you're not exempt whether or not you have a title, whether or not you have a doctor in front of your name, whether or not what your paycheck is, what your zip code is. It is part of the fabric of America that as African Americans or people of color, in spite of it, some have been able to just push through. But the stress factor of living through racism on a daily basis, the stress factor of being denied a decent housing just because of the color, even if you could afford to come up with the enhanced rent that you're being charged to try to take your kids to a decent area. Our kids are suffering from asthma and substandard housing with infestation of bugs that causes these kids to suffer from asthma. Just the mere stress of their environment. You keep talking about social, economic impact on people. We're talking about racism, and that does impact the health. At Jordan Health, the majority of our patients are Black and brown. We know that the zip codes that we serve, so the zip codes that Jordan served, we have as much as 18 years of life loss just based on the zip code that some of our patients live in. That's something that would not be tolerated anyplace else. But because it's impacting people, Black and brown people, for some reason we have decided that we can live with that. We must speak it out. I congratulate the Black Agenda Group for declaring that racism was a public health crisis, but we can't just talk about it. We have to do something about it. And part of what we do at Jordan is encourage people that they have to understand what the issues are. They have to vote, because you only change policy through the people who are in charge, and the people who are in charge are the ones that you put into office. So we believe that community engagement and getting our patients and community to understand that their failure to do something impacts their lives and is killing them and killing us. So
it's almost putting the onus on the patient that they have. It's empowering them, I should say, right? I mean, if they feel that that their future is in their hands, they're going to do things to better their own health and fight for better access.
as we educate, and so you educate and inform people so that they can make decisions. We engage our faith-based community because we do know that historically the shepherds of God's house, their flock listens to them. And so we agitate and encourage our faith-based leaders to have a voice and to educate and inform and give people permission to seek help. Years ago and even now, just having even mental health concerns, behavioral health concerns. Some folks, Black people, we felt that that's a failure in us. It's something that's in us. It's an illness. I come from Detroit, and I remember at 16 being in college, and my instructor, my college professor she said, drugs is an epidemic in our community. In the inner city of Detroit, it's an epidemic. We're dying, we're going to jail. She said, not until tomorrow, when it becomes their problem, will they do something about it. A couple years ago, some of my CEO colleagues from the rural areas and other areas of New York, I said, guess what? It's tomorrow. Now it's an illness. It always was an illness, but now it's an illness that we want to do something about it, because now it's not just impacting Black and brown people, it's impacting your children.
Right. It's become everyone's problem.
It's everyone's problem.
Issue. I want to get to mental health because that you cannot overlook that. And according to the Black Healers Network, Dr. Aycock, the reform group, the Black Healers Network, has stated that racism is a mental health crisis. I want to bring you in on this. Why and how is that?
Oh, yes. So one of the main things is that when you're dealing with mental health issues and concerns, and you can't talk about being Black, you can't talk about what it's like walking into your environment, and you go to these clinics and you have clinicians who don't represent you, clinicians who can't even have a conversation with you. If you look at documentation, it doesn't necessarily reflect Black and brown, population at all. So it really is, you look at the racism in it, it's huge. It's the systemic issue. Blacks are diagnosed more with schizophrenia as opposed to depression or anxiety like white people are. When you look at outpatient visits, Black and brown people are using more of the emergency and inpatient as opposed to, outpatient. And if you just look at the history of it, it's always been that stigma attached to it.
So we just showed something on the screen that's really important to note, and you alluded to this, that about 4% of psychologists are Black, 6% are Hispanic, 4% are Asian. This is according to data from the American Psychological Association Center for Workforce Studies. Why does that matter? Does that improve? Would you say if there were more psychologists of color, or would that improve care, do you think?
Oh, absolutely. Absolutely, because you need that representation. You need to be able to be yourself and talk about things. So I'll give you an example. There was one, I was supervising a clinician, and she was a white clinician, and she was working with a Black family. And this family, this child actually was Black, and the family was white, husband and wife, and they adopted this kid. And the therapist couldn't even talk about this client's hair. And so it was so stressful, and this kid was getting picked on in school because of the hair. And there was no list of, beauty salons that this family could be giving. And so when you talk about these issues, people become defensive. So if you have more Black and brown people in these positions, then you're able to have these conversations, and people don't have to be afraid to talk about what is going on. How many people, if we just do a survey or just ask a question, how many of these clinics in Rochester have talked to their staff and has talked to clients about the mass shooting that has occurred? Those kids are traumatized, and they're going to be traumatized for a very long time. And so, did I answer your question? Because
Well, no, you did, and you've talked about, because you're saying that it's what it provides is culturally competent care. That's what you're saying, right? That if the clinician looks like the patient, there's a different relationship there. It's not saying that a white clinician doesn't care or is not as good as, but that when there's a similarity in background, right, or a similarity in cultural experience, that's pretty powerful, isn't it?
yes, that's pretty powerful. Also, when you can bring various Afro treatment more down to the scene.
Right.
So you need more African American treatment, more dowels. So there's something called play, which is, a treatment that really helps to teach African American boys how to really negotiate their emotions, especially when they're, being confronted with the police. You have emotional emancipation circles. So there's different treatment modalities that's not introduced into a lot of these clinics.
Okay, so you're putting out a challenge to the community to look at what clinicians are taught and how they deal with people of color. So again, that's very powerful what you're sharing with us, and we really appreciate it. And I want to do a quick reset here. If you're just joining us, we've covered a lot of ground tonight. I'm Norma Holland here at the WXXI studios. Our guests tonight are discussing racial disparities in Rochester after the death of Daniel Prude. This is about more than his death or the manner in which he died. There are separate investigations going on right now looking into what happened the morning of March 23rd. Protests and demonstrations show that the community has reached a boiling point, and frustrations have quite literally spilled out onto the streets. What began as a demand for answers has evolved into a quest for dismantling the status quo. But as all of our guests have said tonight, meaningful change doesn't happen immediately. So tonight, we're looking at ways to begin that work and somehow get it right. And again, we want to emphasize we are all physically distanced from each other. Our crew is wearing masks and taking every precaution to make sure that we and our panelists are safe this evening. All right, now I want to turn to some comments from Free the People Rock, which has organized many of the demonstrations in this community. Now, they were unable to join us via video tonight, so we sent them some questions. Iman Abid is a co-founder of the group, and she provided the responses that you will hear. First, we asked her how the recent protests are different from others that have occurred in Rochester. Here's what she had to say. I quote, "The protests here are Black-led and are inclusive of all Black lives. They are strategic and centered on addressing the systemic racism that exists in policing and in all other forms of community. They elevate and empower those impacted by the issues. It is understood that the actions held by Free the People Rock are not the ends, but the means to the end. Every action is designed out of a demand that is specific to moving us one step closer to justice and Black liberation," end quote. Now, Free the People Rock and its supporters recently took time off to reset and regroup after weeks of protest, and we asked them why they did that. Iman said, quote, "This moment in history and this movement is built off of centuries of work put in Black liberation fighters. Police have always known, people have always known, that when organizing, a movement needs its organizers and activists to take a moment to care for themselves. There have been repeated days spent to center Black joy and Black healing, because even those days and moments are a moment of Black resistance. This is a movement that has sustained itself more so than the summer of 1964 and will require care and moments of pause to only grow stronger. We've been doing this work nonstop since May, and it will only continue," end quote. Now, Free the People Rock's list of demands has remained consistent over these weeks. We asked what those demands are and how optimistic the group is that they'll be fulfilled. Iman said, quote, The demands are to fire and bring criminal charges against the officers: Mark Vaughn, Troy Talladay, Francisco Santiago, Andrew Speckscore, Josiah Harris, Sergeant Michael Magri, and Paul Ricotta. To drop the criminal charges against all protesters arrested since March 30th. To immediately prohibit the use of military-grade weapons by the Rochester Police Department. Cut the Rochester Police Department's budget and fund community-led alternatives. Divest Monroe County Jail and invest directly in the Black and brown community. To pass legislation prohibiting police from responding to mental health calls, the state must ensure that trained mental health providers respond in a mental health crisis. And we are asking for the immediate resignation of Lovely Warren, Chief Singletary, and Deputy Mayor James Smith for their cover-up and failure to lead. Again, end quote. That's a lot. That's from Free the People Rock, and I want to ask our panelists to weigh in on this. Natalie Ann, we'll start with you.
I think all of their demands are essential and reasonable, considering how serious a failure this is on all levels of city government, from the police to the mayor's office. I think that the resignation demands are essential. I think we have lost trust in this government, and for good reason. Additionally, I think, yes, all of those protesters need to have their charges dropped. Many of these charges are spurious. I have some of those cases myself, and I'll tell you they are problematic from top to bottom. And I think that the police are using these charges to hide behind their many acts of oppression. One of the biggest problems with this issue is that we have used these charges to obfuscate the real harm that's been perpetrated on hundreds of protesters by the Rochester Police Department. I was at the protests on September 4th and September 5th. I was gassed for doing nothing. I was pepper sprayed for doing nothing. I was terrified. I was charged for doing nothing more than observing my First Amendment rights to protest my government. Protesting your government should not be a terrifying, traumatizing experience, and that is what the Rochester police perpetrated against us. And it's very unfortunate that the criminal charges are being used to obfuscate that very real fact. If this criminal justice system in Rochester is going to make a pretense of holding protesters accountable for their alleged actions, then that needs to be turned around to the Rochester Police Department, because the harm they perpetrated is a much grander scale.
Okay, all right. I want to bring in Professor Stefferson. You alluded to this in the beginning of our conversation about cutting the RPD budget and divesting from the Monroe County Jail. What are your thoughts on what Free the People Rock is asking for?
I think that, first off, they got a plan. So I applaud them for putting something out there for the government to respond to. Now, some of the things I don't agree with is that you create a vacuum without having a transition of power. So to ask for the leadership at the top without having someone in place that you actually have trust in to take the reins and move forward is irresponsible. So as much as I support them in putting out a demand of what they need to see this city move forward, they also have to make sure that there's a transition from one leader to the next. And so to ask for the mayor to resign without having someone in place to run the city is irresponsible. And right now I know personally from having talked with officers that when the police chief was fired, you left the ship rudderless. And so now you have people out there doing what they feel is necessary without having proper leadership and guidance. And so protesters get gassed when maybe they shouldn't be, and so these are the things that come out. When you have actions, there are going to be opposite reactions and not necessarily equal. And so I think that you got to make sure that things are in place. You don't want to create a vacuum.
We should point out there was recently the appointment of a new interim chief, Cynthia Harriet Sullivan, who assumes her role as interim police chief on October 14th coming up. All right, Dr. Aycock, can you weigh in on this, on the list of demands from Free the People Rock?
So I think that the list is, reasonable and something that should be discussed. Really want to focus also on the fact that you have, Natalie said it, she's out there, she was, pepper sprayed, and she was just standing there and, speaking her truth. And so were all the other protests. So now we're going to look at the level of trauma that these individuals are going to experience. And that is very disheartening and that needs to be looked at. So, yeah, when we talk about the demands, when you talk about no justice, what's going to happen to us psychologically? When we don't get justice, when we see that we're being beaten and we see that we're being killed by law enforcement and nothing is being, held responsible.
One of the list of demands is that that there are changing the way that we deal with mental health calls, and that we change those, the method in which we do that. There's actually a really interesting program at the Whitebird Clinic in Eugene, Oregon. It's drawing a lot of attention. The Crisis Assistance Helping Out on the Streets, or CAHOOTS program, is a mobile crisis response team dispatched by public safety to respond to emergency calls for everything from crisis counseling to substance abuse issues, housing, and more. A crisis worker trained in mental health care and an EMT generally respond to most of these calls rather than law enforcement. Tim Black is the director of consulting at Whitebird Clinic. He answered some questions that we had via video. The first question is, how does CAHOOTS, this program, approach and create safer interactions between people in crisis and or police? Here's what he had to say.
The presence of our program presents an opportunity to allow safer interactions between the public and public safety by first and foremost reducing the likelihood that somebody's going to have an interaction with an officer as a result of the crisis that they're experiencing. And as far as the safer interactions between somebody in crisis and the CAHOOTS response teams, it's really our training emphasis on verbal de-escalation, compassionate communication, things like scene safety and situational awareness, and even harm reduction and unconditional positive regard that allow us to have interactions that look nothing like what you would see with an EMS provider, with a firefighter, with a police officer. And it's that alternative approach to our interventions that allows us to really maintain safety for everybody that's involved.
All right, next we asked Tim Black what the relationship is between the CAHOOTS staff and police, and here's what he said.
We do, however, work with traditional public safety infrastructure on a pretty regular basis, and we really value our relationships with the police department, with fire and EMS providers, and we don't really shy away from giving feedback to officers in the moment, or talking with command, in debriefing a situation. And we have that same expectation of our partners in public safety, and that means that really, as we work together to respond and serve this community, we're all holding each other accountable and really working together to lift each other up. We do have regular meetings with our police departments that we work in partnership with to make sure that things are running smoothly and that we're able to address issues as they arise. And when there are disagreements about what kind of approach should be taken, for instance, on a scene, we try to respond to that conflict the same way that we would a conflict with our patients, which is to really listen, empathize, and then work together to find resolution and through that collaboration achieve something greater.
So would a program work like this in Rochester? We asked Tim what a city needs to have in place in order to successfully implement a program like CAHOOTS.
As we talk with other communities that are looking into the CAHOOTS model and exploring, is this something that we want to bring in? Is this something that's really going to be beneficial to our community? There are some things that we really need to recognize about the success of CAHOOTS here in Eugene and Springfield, and that's that everything that we're able to do, all of the outcomes that we have for our community are predicated on our relationships with other services. In order to divert somebody from the hospital or from the jail, you have to have somewhere else to take them. And when communities are really looking at what are the resources that we need to divert folks from that criminal legal system, what are the things that we need to make a mobile crisis response successful in our community, the services that need to be out there as part of that kind of constellation of support are going to be services that are low barrier and culturally competent, oriented around housing, basic needs, mental health and crisis resources, as well as those related to addiction, including outpatient resources and sobering and detox. It's really when we have that kind of, as I said, that whole constellation of services in a community, a mobile crisis program has the opportunity to come in, act as the hub, connecting folks to all the different spokes in that wheel, and empower them so that the next time a crisis unfolds in their life, maybe that person has a connection now at that other resource, and they're able to, rely on those lower level responses instead of only utilizing cahoots as the means of de-escalating the crisis they're experiencing.
All right, Dr. Harbin, do you think the Rochester area has these supports in place? And if not yet, what would it take for us to get there?
Not yet. I would say at Jordan, we have been talking for several years, and we actually, about a month and a half ago, we brought together about 30 of the community leaders, including both health systems, in a conversation about a community health village. So that is more of a one-stop. What are the safety net components that centralized? People can walk to it. And it was centered around our health centers in the 3 quadrants. But the whole focus is what needs to be in place to support the everyday person, the person in crises. If you're going even for substance abuse care, it's a difference if you're going into a door that anybody could be going in the door. They could be going in to have their teeth cleaned. They could be going into to the podiatrist. No one knows why you're going into that door, where you could seek help with respect. I think is a wonderful model. I think in Rochester there is the will and desire to come together. We're having ongoing conversation about what a community health village looks like. And this model of having actually more boots on the ground, that there's a place to bring them back to, would be a wonderful model. But what the young man talked about, we have had some of our patients released to the House of Mercy when the House of Mercy was on Hudson Avenue. How is that stabilizing someone? Housing is an issue. Beds are issues for mental health and behavioral health and different issues like that. We're not ready.
Okay.
We're having the conversations, but we are not ready to actually provide the support. Is there the will? There's a will, but there have to be financial support. We have to stop working in silos. I've been a dentist for 41 years and public health 41 years. And these silos drive me nuts.
Right.
It's an old African proverb: if a child is not embraced by its village, it will burn it down to feel its warmth. All around us, they're burning things down to feel the warmth, feel the embrace that's not happening. So I believe there's a will, but we don't have the structure in place, and we do need to look at best practices and come together as a community to put in place collectively and stop working in these silos.
Simeon, I'd like to bring you in on this as well. Do we have the supports in place to make something like what's happening in Oregon happen here?
So the short answer is no. I imagine that viewers probably feel similar to the way that I do, that it always feels like we're nibbling on the edges. It always feels like we're adding another thing, another program, another effort, and not catching the kind of macro concern. We had an interesting conversation today at the Anti-Poverty Initiative to talk a little bit about some strategies that really try to arrest kind of some what might be the root of the problem. In Rochester, folks should know that the city of Rochester's median income mean income, the average, is $55,000. Monroe County's is $86,000. So just let that sink in for a second and think about what income does, right? When you've got dollars in your pocket, how your life is different. Think about what poverty does, how it constrains choice, how it compresses time, and the potential implications that that has for choices that people are then forced into and pushed into. Choices that we all spend a lot of effort, a lot of time, a lot of money trying to deal with, right? There's got to be a smarter way to deal with this than the ways that we've been doing so, with more and more programming, largely because that programming, and Dr. Aycock kind of pointed to this earlier, that programming seems to pay the same kinds of folks,
right?
And those folks aren't the folks that are often affected, and by that case I mean Black and Indigenous people of color, who are typically the folks that we're talking about. And so I would argue, if you take mental health as an example, there are Monroe County contracts $40 million with mental health organizations. Of the 24 organizations, 2 of them are led by people of color. Many of them lack diversity, and those are real dollars that pay salaries that end up in people's pockets. And so we've got to rethink, how we're approaching many of the challenges that we face. The other thing I'd say is that ultimately, this question of I just want to really quickly riff on.
We've got about 30 seconds left. Simeon, if you could hold some of that, because we're going to be on again after 9 o'clock, and we want to get to to all of what you're saying. So please join us after 9 o'clock. I want to thank all my guests for their time: Simeon Bannister, Natalie Ann Knott, Dr. Janice Harbin, Professor Marvin Stefferson, and Dr. April Aycock. We thank you so much for your insights tonight. We want to thank you for joining us tonight for WXXI's Life Forum. We will continue these important conversations across our WXXI platforms, including a conversation about the Black Healers Network and culturally competent care on Connections with Evan Dawson tomorrow, October 2nd. And you can find this broadcast and more reporting about racial disparities in our community at WXXInews.org. If you're watching on WXXI-TV or listening on AM 1370 tonight, October 1st, we'll return to our regularly scheduled programming now. But if you want to hear more from our guests, please go to WXXInews.org or join on WXXI News on Facebook Live to continue this conversation with our guests until 9:30. And we want to know what you think about this program. You can call our audience response line at 585-258-0360 or send us an email at forum@WXXI.org. I'm Norma Holland. From all of us here at WXXI, stay safe and stay healthy. Good night.
WXXI's Live Forum is made possible with support from Excelis Blue Cross Blue Shield, with a mission to help people live healthier and more secure lives through access to health care. And by the Greater Rochester Health Foundation, working to pursue and invest in solutions that build a healthier region where all people can thrive.